Hello, and thank you for joining me today for the Medicare Coverage on Behavioral Health Services presentation. My name is Melissa Devine, and our presentation is brought to you today by the Medicare Medicaid Assistance Program in the Area Agency on Aging 1B. Today, we will discuss who the Medicare Medicaid Assistance Program is, what we do, what behavioral health care is, what the coverage is for outpatient and inpatient, addiction recovery, mental health, and opioid treatment. Let's get started with the Medicare Medicaid Assistance Program, often referred to as MAP. MAP is Michigan's Medicare Medicaid Assistance Program. Our counselors are certified and have been trained in healthcare benefits counseling. This includes Medicare, Medicaid, and other insurance products. Our counselors are not connected with any insurance company, and they are not licensed to sell insurance. In many states, MAP is called the SHIP program. That's the State Health Insurance Program. Again, we are comprised of unbiased counselors located all across Michigan, offering free health benefit counseling assistance. A MAP counselor can help you understand your new healthcare options, understand Medicare and Medicaid, compare or enroll you in a Medicare prescription drug coverage, review Medicare supplemental insurance needs, help you understand Medicare health plans, apply for Medicaid or a Medicare savings program, and help you identify and report Medicare and Medicaid fraud and scams. Now let's take a look at what behavioral health care is. First, we need to define behavioral health care. Behavioral health care is an umbrella term that refers to services and programs intended to help diagnose and treat both mental health illness and addiction-related issues. According to the National Alliance on Mental Illness, a mental illness is a condition that affects a person's thinking, feeling, or mood. Examples of mental health illness include depression, anxiety, and schizophrenia. Substance use disorders and addiction do not fall under this definition of mental health illness, but they are considered behavioral health conditions. Examples of addiction disorders include opioid use disorder and alcoholism. It is important to note that behavioral health conditions are typically not the result of any single event or circumstance. Rather, they tend to be complicated conditions involving an interplay of biological and environmental factors. There are several diagnostic and treatment services that Medicare covers within behavioral health care. Those are inpatient treatment, outpatient treatment, partial hospitalization, addiction recovery services, medications for mental health care, and opioid treatment programs. We're going to look closer at the Medicare coverage of those diagnostic and treatment services. Let's look a little closer at the behavioral health care of inpatient and outpatient. Medicare Part A covers inpatient mental health and addiction recovery services that you receive in either a general hospital or inpatient rehabilitation facility or a psychiatric hospital. A psychiatric hospital is a hospital or distinct unit in a hospital that only treats mental health patients. Your doctor should determine which hospital setting you need. If you receive care in a psychiatric hospital, Medicare covers up to 190 days of inpatient care in your lifetime. If you've used your lifetime days but need additional mental health care, Medicare may cover additional inpatient care at a general hospital. You will have the same out-of-pocket costs with original Medicare, whether you receive inpatient care in a general or psychiatric hospital. The Part A deductible. Before Medicare covers the cost of inpatient care, you have to meet the deductible for the benefit period. In 2021, the deductible is $1,484. Benefit periods measure your use of inpatient hospital and skilled nursing facility services. A benefit period begins the day you are admitted to a hospital as an inpatient or to a skilled nursing facility and ends the day you have been out of the hospital or skilled nursing facility for 60 days in a row. For days 1 through 60 of a benefit period, after you've met the deductible, Medicare will pay in full for the first 60 days of your care. Days 61 to 90 of a benefit period, Medicare pays part of the cost and you are responsible for a daily coinsurance charge. In 2021, the coinsurance is $371 per day. For lifetime reserve days, you have up to 60 lifetime reserve days, and Medicare pays part of the cost. You are responsible for a daily coinsurance charge. The coinsurance in 2021 is $742 per day. Note that if you enter a psychiatric hospital within 60 days of being an inpatient at a different hospital, you are in the same benefit period and do not have to pay a Part A deductible again. If you have a Medicare Advantage plan, your plan must cover the same mental health and addiction recovery services as original Medicare, but may impose different costs and restrictions. If you need information about the cost and coverage requirements, or if you are experiencing problems, you should contact your Medicare Advantage plan. Medicare Part B covers outpatient behavioral health care, including the following services when medically necessary and delivered by a Medicare enrolled provider: individual and group therapy with a doctor or other license-related health professional, substance use disorder treatments, tests to make sure you are getting the right care, occupational therapy if the main purpose is to help with treatment, activity therapies such as art, dance, or music therapy if the main purpose is to help with your treatment, training and education such as training on how to inject a needed medication or education about your condition, family counseling if the main purpose is to help with your treatment, laboratory tests, prescription drugs that you cannot self-administer such as injections that a doctor must give you, an annual depression screening that you receive in a primary care setting. You should speak to your doctor or primary care provider for more information. The depression screening is considered a preventative service, and Medicare covers depression screenings at 100% of the Medicare approved amount. An annual alcohol misuse screening, and if after the screening your doctor determines you are misusing alcohol, 4 brief counseling sessions per year that you receive in a primary care setting. The alcohol misuse screening and 4 brief counseling sessions are considered preventative services, and Medicare's coverage is at 100% of the Medicare approved amount, meaning there is no cost sharing if you see a provider who takes assignment to Medicare. Medicare Part B covers care you receive through an outpatient hospital program, at a doctor's office or a therapist's office, or at a clinic. You may receive services from the following types of providers: general practitioners, nurse practitioners, physician assistants, psychiatrists, clinical psychologists, clinical social workers, and clinical nurse specialists. You should make sure that any provider you see accepts assignment, meaning that they accept Medicare's approved amount as full payment for service. This is to avoid paying more. If you see a non-medical doctor, such as a clinical psychologist or clinical social worker, it is especially important to make sure that your provider accepts Medicare payments. Medicare will only pay for the services of non-medical providers if they are signed up to accept Medicare payments. Please note that psychiatrists are more likely than any other type of provider to opt out of Medicare. An opt-out provider does not accept Medicare payment and has signed on an agreement to be excluded from the Medicare program. You should be sure to ask any provider if they take your Medicare insurance before you begin receiving services. If you see an opt-out provider, the provider must have you sign a private contract. The contract states that your doctor does not accept Medicare payment and that you must pay the full cost of the service. Medicare will not reimburse you if you see an opt-out provider. If an opt-out provider does not present you with a private contract, you are not responsible for the cost of the services. Medicare Part B covers partial hospitalization for mental health treatment. Partial hospitalization programs offer outpatient care in a hospital setting on a part-time basis, which can mean only during the day, only at night, or only during weekends. Partial hospitalization programs provide care that is more intensive than other forms of outpatient mental health care, but less intensive than inpatient care. In such a program, you will follow a plan of care tailored to your needs. Services may include the following: individual or group therapy, occupational therapy, activity therapies such as art, dance, or music therapy when they are used to help treat and meet the goals of your plan of care, prescription drugs that you cannot administer yourself, training and education closely related to your plan of care, family counseling that primarily supports your treatment, not if it primarily promotes the general well-being of the family, and services needed to diagnose your condition and evaluate your care. Partial hospitalization programs may be offered by hospital outpatient departments and by community health centers. Medicare covers your partial hospitalization care if both of the following apply. A doctor certifies that you would otherwise need inpatient treatment, or you have recently been discharged from inpatient care and need partial hospitalization to avoid a relapse in your condition, and that less intensive treatment options, such as outpatient therapy, would not be enough to help you avoid hospitalization, and that you receive care from a Medicare certified program. Now let's move on to the addiction recovery services. Medicare covers treatment for alcoholism and substance abuse disorders in both inpatient and outpatient settings if your provider states that the services are medically necessary. You receive services from a Medicare-approved provider or facility, and your provider sets up your plan of care. Covered services include, but are not limited to, patient education regarding diagnosis and treatment, psychotherapy, post-hospitalization follow-up, opioid treatment program services, FDA-approved opioid treatment medications such as methadone, naltrexone, and buprenorphine, dispensing and administering drugs if applicable, substance use counseling, individual and group therapy, toxicology testing, intake activities and periodic assessments, prescription drugs administered during a hospital stay or injected at a doctor's office. Methadone may be covered in inpatient hospital settings. Outpatient prescription drugs covered by Medicare Part D. Medicare Part D plans must cover medically necessary drugs to treat substance use disorders. Part D plans cannot cover outpatient methadone or similarly administered medications to treat substance use disorders, but they can cover methadone for other conditions such as pain. Structured assessment and brief intervention services provided in a doctor's office or outpatient hospital are covered by Medicare when an individual shows signs of substance use disorder or dependency. These treatments involve screenings, which is assessment to determine the severity of the substance use disorder and identify the appropriate level of treatment, brief intervention, which is engagement to provide advice, increase awareness, and motivate individuals to make behavioral changes. Referrals to treatment. If an individual is identified as having additional treatment needs, this provides them with more treatment and access to specialty care. Medicare Part A covers your care if you are hospitalized and need treatment for substance use disorder. Cost-sharing rules for an inpatient hospital stay should apply. If you're receiving care at an inpatient psychiatric hospital, keep in mind that Medicare will only cover a total of 190 lifetime days. For addiction recovery inpatient care, you have the same out-of-pocket costs with original Medicare. That would be the Part A deductible of $1,484 per benefit period. Within days 1 through 60, once the $1,484 deductible is met, Medicare will pay in full. For days 61 to 90, Medicare will pay part of the cost, with the beneficiary or patient paying a $371 coinsurance per day. For lifetime reserve days, you have up to 60 lifetime reserve days that Medicare will pay part of the cost for, with a patient paying $742 coinsurance per day. Medicare Part B covers outpatient care for a substance use disorder that you receive from a clinic, hospital outpatient department, or opioid treatment program. Note that some substance use disorder treatments can also be provided using technology services, sometimes called telehealth. Original Medicare covers mental health services, including treatment for alcoholism and substance use disorders, at 80% of the Medicare approved amount. As long as you receive the service from a participating provider or one who takes assignment with Medicare, you will only owe a 20% coinsurance after you've met your Part B deductible. If you're enrolled in a Medicare Advantage plan, you should contact your plan for the cost and coverage information about treatment for a substance use disorder. Your plan's deductibles and copays or coinsurances may apply. For the out-of-pocket costs with original Medicare, the Medicare Part B deductible is $203 annually. Medicare will pay 80% of the Medicare approved amount after the $203 annual deductible is met. Then, a 20% coinsurance is owed by the patient once the deductible is met. To get Medicare prescription drug coverage, you must be enrolled in a Medicare Part D prescription drug plan. Part D is offered through private insurance companies, either as a standalone plan for those enrolled in original Medicare, or as a set of benefits included with Medicare Advantage plans. Part D plans will vary in cost and specific drugs that they cover. Each plan has a list of covered medications called a formulary list. You should check before joining a Part D plan to ensure that any medications you take are on that formulary list. If your medication is not on the formulary list, you may have to request an exception, pay out of pocket, or file an appeal to ask your plan to cover the medication. While Part D plans are not required to cover all medications, they are required to cover all antidepressant, anticonvulsant, and antipsychotic medications with limited exceptions. Some medications used to treat substance use do not meet certain requirements for coverage under Medicare Part D. These medications can be covered by Part A during an inpatient stay or Part B as part of the medication-assisted treatment at an opioid treatment program. Opioid treatment programs. Medicare Part B covers opioid use disorder treatments received at opioid treatment programs. Opioid treatment programs, which are also known as methadone clinics, are certified by the Substance Abuse and Mental Health Services Administration to provide methadone as part of a medication-assisted treatment. Opioid treatment programs are the only place where an individual can receive methadone to treat opioid use disorders. In order to receive Medicare coverage for opioid treatment services, the opioid treatment program must be certified by a Substance Abuse and Mental Health Service Administration and enroll in the Medicare program. Once an opioid treatment program is enrolled in Medicare, it can bill Medicare for the services provided to you. Therefore, if you want to get Medicare-covered opioid treatment program services, you should contact the opioid treatment program to make sure it accepts Medicare. If the opioid treatment program is not enrolled in Medicare, you are responsible for the cost of the care. If you have both Medicare and Medicaid and were previously receiving Medicaid-covered opioid treatment services, Medicaid should continue to pay primary for treatment until the opioid treatment program is enrolled in Medicare. At this time, once you met your deductible, you will not owe any cost sharing, coinsurance, or copayment for the opioid treatment program. A drug management program is a tool that Part D plans can use to limit at-risk beneficiaries' access to certain drugs. Plans use clinical guidelines to identify beneficiaries who are at risk for misuse or abuse of frequently abused drugs, such as opioids. At-risk beneficiaries may be required to use one provider and/or one pharmacy to get flagged medications. This is known as a pharmacy-provider lock-in. If an at-risk beneficiary has extra help, an assistance program that helps pay for the cost of medications, they cannot use the Extra Help Program special enrollment period to make changes to their coverage. Normally, the Extra Help special enrollment period allows most beneficiaries with extra help to change their coverage once per calendar quarter for the first 3 quarters of the year. If a beneficiary is found to be at risk, their plan must send 2 notices. The first notice declares the beneficiary potentially at risk. It includes the plan's proposed coverage limitations, such as a pharmacy lock-in, information on any limitation of the availability of the extra help special enrollment period, if relevant to the beneficiary, the time frame for the plan's decision. The beneficiary has 30 days to submit relevant information, for example, information about why they may be exempt from the lock-in, to the plan. They also may submit pharmacy or prescriber preferences in case of a proposed lock-in. The second notice declares the beneficiary at risk and gives them the option to select provider and pharmacy preferences, as well as to appeal for redetermination. A safety review is a check that a plan and/or pharmacist may do if you fill a prescription for certain medications, such as an opioid pain medication. The safety review may be for potentially unsafe opioid amounts, opioid use with benzodiazepines, new opioid use, in which case you may be limited to a 7-day supply or less. If your pharmacist cannot fill the prescription because it is deemed unsafe, the pharmacist should give you a notice about how to request a coverage determination from the plan. Requesting a coverage determination is the first step you must take before beginning the appeal process. If the plan denies coverage, you can begin an appeal to ask your plan to cover the drug. If possible, you should contact your doctor for support with an appeal. Outpatient mental health care fraud occurs when Medicare is billed for mental health services that you did not receive. You can report this fraud and/or errors to your senior Medicare patrol or MAP. Our contact information is 1-800-803-7174. Report potential outpatient mental health care fraud, errors, or abuse If you spend the day at a facility playing games or watching TV, and Medicare is then billed for group psychotherapy, you and other beneficiaries are picked up by a bus or a van, taken out for a meal, and then Medicare is billed for psychiatric evaluations. You see incorrect charges on your Medicare summary notice or explanation of benefits, such as mental health services in excess of what you received or that you never received. For more information on the outpatient mental health care fraud, please view S&P's tips for protecting yourself and Medicare on the topic. Would you like to help seniors save money on healthcare and prescription costs? Call MAP at 1-800-803-7174 to learn more and join the MAP program. Volunteer counselors with our nonprofit Medicare and Medicaid Assistance Program work one-on-one with seniors in their neighborhood to help with them understand their plan choices and get the most out of their benefits. We are looking for people who are friendly, computer savvy, and enjoy helping others. What you'll do as a MAP counselor is counsel over the phone or in person, walk people through their plan choices, answer questions and help people work through problems, and see if people qualify for low-income benefit programs and help them enroll. What you'll get is a comprehensive training and to be a part of a dynamic and supportive statewide team. You'll meet people, learn and engage with your community, and help people in your neighborhood. For more information about volunteering or how MAP can help, call us at 800-803-7174 or visit aaa1b.org. If you have any questions or for more MAP assistance, please feel free to reach out to us via email at mdevine@aaa1b.org or call us at 800-803-7174. Thank you so much for joining me today. I hope you enjoyed our presentation on Medicare's coverage of behavioral health care services. Have a wonderful day.